Good afternoon. So last we started with a small remedy, and one part of that remedy is what we have discussed in detail. Next 2-3 minutes we will quickly revise what was told, and then we will continue, or if time permits we will try to conclude today's remedy. Okay. So the remedy that we spoke in the last class, selenium. Okay. Now what was told to you about selenium? What were the key points? Okay, we spoke of impotency, good. It's a valid thing in selenium. We'll discuss in detail about impotency. Yeah, so broadly, I spoke to you about the introduction. Or we introduced you to selenium. And under the introduction, we mainly spoke of sphere of action, correct? And then we spoke of ailment storm. And if I am right, we also spoke of the physical appearance. How exactly the selenium constitution is. Okay. So how do they look physically? Old looking, they look emaciated. So emaciation is also an integral part of selenium. So there is emaciation, they look old. Prematurely old looking people. By now you know so many medicines. You should also include selenium into the list. Old looking, prematurely old looking people. Weak, lean, thin, debilitated. And ailments and sphere of action we have discussed in detail. We have had a lot of comparisons, right, with other remedies. What other remedies can do and what selenium does is what we have understood. Okay. Quickly, sphere of action. Where do you see selenium acting? Liver, good. Larynx, yes. It does not affect the entire respiratory tract. It has got a special affinity for the larynx. We'll explore more. So larynx, liver, genitalia, both male and female genitalia. And what was the first slide that I showed you, How did we enter selenium? Yeah, so what was that? Why did the peak of eyebrow came up there? Supraorbital nerve. The affinity of selenium for supraorbital nerve. Okay, these were the few important things. And ailments, we have discussed in detail. What were the common ailments of selenium? Sexual excess, debauchery, good. Tea, yes. Sugar, lemonade, salt, alcohol in general, sexual excess. You have plenty. Okay. So what we'll do in the next few minutes is we'll talk of a very important part. And that important part that we are going to discuss is we'll be looking at the characteristic symptoms. So with the characteristic symptoms, we'll also try to take up some generalities, and next 30-40 minutes, hopefully, we'll try to complete selenium. Okay. So we'll also, keeping the PG class in mind, we'll try our best to have a good amount of comparison, so that it will have an impact, the class will have an impact on your future practice. Okay. So when I say PG, what I had in my mind is selenium is already done in your UG. So before I start my presentation as a PG scholar, what exactly you feel or what exactly you remember which are characteristic in selenium? Okay, Karthik is talking of hair fall. Very good, absolutely right. Hair fall, there's something very special. If you can answer that, we'll take it up. Otherwise, it will come up in the PPT. Good. Appreciate hair fall. Beautiful remedy for hair fall. Okay, good. Apart from hair fall.
Excretion of prostatic fluid during stools.
Okay, so there is escape of semen during stool. Good, that's also valid. Equally valid, because one of the top remedies which has escape of prostatic fluid or escape of semen during stool. Not only during stool, I will be giving you a case, I will be giving you few more information about selenium. Okay, good. So both are valid, hair and of course its affinity for semen, and we'll explore a little more in detail. Anything else?
Constipation.
Yes, Brahmara is talking of constipation. Okay, good. Again, constipation You might be knowing many remedies. We'll go with the flow. But before I start the PPT, good warm-up exercise, constipation, hair, and issues with semen. Good. Anything else? Cholera ends in diarrhea. Okay, good. To be very honest, I'm not aware of the symptom. If others agree, I'll take it. Okay, good. Cholera is this. Okay, good, very good. So cholera ends in diarrhea. Okay. So there is cholera, in the ending process. What you see is there is diarrhea. Good. Thank you. I also learned something. Okay, cholera ending in diarrhea. Good. Anything else?
Headache in the tea drinkers.
Yes, good. Headache in tea drinkers. Correct. It's there. It is there. And when I told you tea as an ailment, we have looked into what exactly selenium can cause in tea drinkers. And headache is something that comes up in tea drinkers in selenium. Okay, anything else? Okay, good. To start with, good. I'll just try to give you something very important. It is not the post-lunch session. I'm not doing this image keeping today's class in focus. But what I want you to understand is a selenium patient, when we spoke of the physical appearance, similarly, selenium is a person or a constitution who gets prostrated very easily. Debility which comes very easily. Okay. So what brings on debility is the question. Summer, okay, sun, debility from sun, valid. Very good. Slightest mental and physical exertion. Good. Agreed. Two very valid points.
Infectious disease.
Beautiful. There is some clause in selenium. Okay.
Active disease.
After prolonged fever. Okay. You have some 5-6 remedies. That's why selenium becomes very important. And only 3-mark remedy among those 5-6 remedies is selenium. So debility after, this is my first thing, debility after prolonged fever. Okay? Now what do you understand by prolonged fever? Please understand homeopathy. The stalwarts did not mention debility after fever. So what is the sentence given here? What is the symptom mentioned? Debility after prolonged fever. Meaning fever is there for quite some time. 15 days, 3 weeks, 1 month. Okay? Prolonged fever. And then they have debility. Okay? So it is not like debility after an acute illness. You have fever for 3 days and you feel weak. Selenium may not fit in there. So if it has to be selenium, it has to be prolonged fever. Okay? Any other remedies you can think of in this situation? Carbohydrates is after exhaustive or debilitating disease, acute disease. And what happens in carbohydrates? They mainly land up with hair fall. And many of us successfully used carbohydrates after COVID. There was one of the important things you saw. People had hair fall. Thallium met. Okay, was also a remedy, a rare remedy which was indicated. Fluoric acid. Now when do you see hair fall in fluoric acid? Very good. Hair fall in typhoid. Single remedy, fluoric acid. Good. We'll anyway talk more in detail about hair fall a little later. Okay, we're talking of debility. And unfortunately, fluoric acid will not fit into debility because fluoric acid is untiring horse, highly energetic. So fluoric acid has no role when we are talking about debility. Okay. So debility which comes from prolonged fever, 4 more remedies you should know is Seminal. Okay. Muriatic acid, ambragracia and colchicum. These are a few remedies which have prolonged, debility after prolonged fever. Okay. Now debility, this is what Dr. Brahmara was trying to tell us. Debility from slightest physical or mental exertion. Like 4 steps or a little amount of walking can bring in debility. Similarly, little emotional strain, mental strain can bring in debility. Okay? Here you can think of some remedies as for comparison. Picric acid. Picric acid will be mainly from mental exertion. Okay. Mainly from reading. If you want me to be more specific, debility after reading. Picric acid. Califos. Simple. Califos. Naxomica, arsenic. Okay. Calcarea, lacasis, lecithin. Lecithin, natrum car, pulsatilla, solanum. These are few remedies. Ailments from sexual excess. Not ailments from. We are looking at the debility. Debility from sexual excess. Other remedies? So when you talk of debility from sexual excess, you can also think of debility from loss of fluids. Yeah, I've just given you a clue so that you can answer. Cinchona, acid fast, stepisagria. But when you're looking at this debility from sexual excess, the remedies will be Agnes. Simple remedies, Agnes, caladium, avena sativa. We generally tend to ignore small remedies. Agnes, avena, caladium, china, arsenic, natron, phosphoric acid and phosphorus. Now we have what you are all trying to tell me, loss of vital fluids. You have a list of remedies. And luckily 2 remedies are already covered here. 2 important remedies, china and phosphoric acid. Solanum, sepia and calcarea. And any slightest exertion can bring on debility. Okay? So what I want you to understand here is debility in selenium. What can bring on debility in selenium? Okay? So quickly next 2-3 minutes. In a previous class, I don't remember the remedy, we have discussed debility in detail. Okay? But if you want to bring in some remedies, quickly for debility, you are free to share or you are free to contribute. Acids. Okay, acid group. You know. The only acid which will not go into debility is fluoric acid. Majority of the acids, they are weak. They are debilitated, good acids. Then carbohydrates, when? After antibiotics, single remedy. Debility after antibiotics, single remedy, carbo, veg. Okay? Carbo animalis, debility which comes from lifting, good. Padmashri, debility from lifting. Rota, I'm giving you random remedies. Rota after walking. They would have walked and after they come back or after walking, if they feel weak, tired, the remedy is Rota. Okay? Right? After, chemotherapy. Debility after chemotherapy. Sepia. See, there is a beautiful chapter under generalities. Okay? Weakness. And you have n number of subrubrics from A to Z. So, when time permits, have a look. It can be very handy in your practice. But the focus is selenium's debility. And second very important thing, what you see here is, again the image is taken from Google. So what you see is emaciation. Okay? This gentleman's picture is taken here, which also gives you a clue. Emaciation in old people. Selenium is one of those few remedies which is indicated in emaciation of old people. Okay? Now any other peculiarities you have when you talk of emaciation in selenium? When do you think of natronure and iodine in emaciation? In spite of ravenous appetite, that is how books give you. So similar situation you have in selenium. In spite of eating well, they have emaciation. Okay, that's one thing. And second thing is emaciation, which comes after loss of fluids. Emaciation, I told you, mainly seen in old people. Emaciation in old people and emaciation of the affected part. A better remedy? Plumbo, very good. Plumbo. especially in paralysis. Okay? So there is muscle wasting, there is muscle loss of the affected part, plumb out. Now more important for you, which I want to highlight in selenium is emaciation of single part. This is the PQRS of selenium. See, loss of fluids, old men, affected part after ravenous eating. You have many remedies. Okay? The PQRS in selenium is emaciation of single part. Now what do I mean by single part? Like for example, emaciation of face. The entire body is nice. Emaciation of face, or emaciation of hand, or emaciation only of thigh. Okay? So this you can interpret as emaciation of single part. Face, hands, thighs. Selenium. Selenium. Okay? Any remedies quickly for comparison, emaciation? Abroadina. How is it in Abroadina? Ascending. Ascending. Okay? If it is descending? Lycopodium. Done. So lycopodium, what you have is upper part emaciated and lower part semi-dropsical. Netremure? Neck. Clavicle. This region. Okay, again, a little of the upper part, netremure. Okay? Done. And you are all talking of hair and selenium. Now, first question for you is, from the image, what do you interpret? Hair fall? Hair fall, okay. Yeah, hair fall on combing. Never they have hair fall. Bathing. But hair fall is seen only on combing. Which is the single remedy? Hair fall on combing. We have patients coming and telling, sir, when I comb, I see good amount of hair. Good amount of hair loss. It's not natural. No issues. It's not natural. No problem. So the single remedy is cantharis. Hair fall, combing while. Cantharis. Single remedy. Okay? Now, when do you see hair fall? In selenium. So before I take up that particular symptom, I also want you to contribute the other remedies for hair fall. Phosphorus, good, agreed. Arnica. Cilicia, good. Badiaga, good. Appreciate. All the remedies. Acid floor. And acid floor, we already gave you an indication. In typhoid. Okay. Single remedy mentioned in your repertoire is fluoric acid. In typhoid. After typhoid, you can have remedies like carbobase. Okay. And acid floor is also one top remedy for alopecia areata. Okay. One 3-mark remedy mentioned in your repertoire, alopecia areata. Hair falls in spots. It's an autoimmune disorder, you know that, alopecia areata. Right? So we have fluoric acid. Simple remedies like sepia, netremure. Netremure, what is the thing? Okay, so you have eruptions over here margins. We are talking of hair loss. After pregnancy, after delivery, during nursing, okay, lacasis, sepia, netremure, beautiful remedies, okay. Badiaga, arnica, bisphenol. I have never used Badiaga and bisphenol, to be honest, but literature talks high about all those remedies. If you get a chance, don't hesitate to use all those remedies. Okay. So hair fall is one important symptom in this particular remedy. Apart from hair fall, we are coming to a very important part of selenium. What is it that you have in selenium? When is selenium indicated in alopecia? Right? That is the question. So one remedy that you need to understand is hair fall from the whole body. Meaning, wherever there is hair, you can see hair fall in selenium. Right? So for example, scalp, for example, eyebrows, or for example, beard area, mush area, or genitalia, just anywhere, you name it. So books talk very high, literature talks very high about selenium, hair fall from any part of the body in which you see hair. Hair fall from whole body, scalp, eyes, brows, whiskers and genitalia, genitals. Very important. Okay. Recently I had a case of a boy with dandruff over eyebrows. Okay. So but why I am giving you this example now is, never underestimate any information that is given in your material medica. You never know who comes with what symptom. And you should be ready to prescribe. So which is the remedy? Sanicula. Good. Sanicula. Done? At least you use it or not, it is secondary. Or you are lucky that you get a patient like that is also secondary. But knowledge is important and you need to have it. So luckily, he improved very well after Sanicula. Here, sorry, what is it? Dandruff over eyebrows. Dandruff over eyebrows. Okay. Now, very important, many of you have already spoken about this before I started the class. Shalaka was talking of the affinity of selenium for larynx. Okay. So what exactly you see in selenium, related to larynx? What you see is, you mainly see hoarseness of voice. Voice feels weak, voice feels hoarse. That is important. Okay. And then also another symptom I mentioned in your first class. What was that? Very good. Nodules. Vocal cord nodules. Okay. Two more remedies we discussed. One was berberis and the other one was tuja. Berberis and tuja. And I also shared a case of a Pandit in a temple, who had hoarseness of voice. And unfortunately, I did not get any other symptoms. Though I tried to look into the conflict, why his voice has gone hoarse, I did not get anything. And I landed up giving him tuja. And it's almost 2-3 follow-ups of beautiful improvement with his voice. Tuja for vocal cord nodules. If you are not getting anything. Berberis vulgaris is mentioned in your repertory. Especially left-sided vocal cord nodules. And you can also think of selenium. Okay. So hoarseness of voice, aphonia after long use of voice hoarse as soon as he begins to sing, talk or read. And aphonia or hoarseness of voice affected by every chord. Nodules on vocal cords. So these are few symptoms I've taken from the source books. Okay, so remember this in selenium. In the first class we have discussed many remedies. Okay, we spoke of calcarea, we spoke of carbohydrates, we also spoke of indications of staticide gland. I shared a case, we forgot, it's only 2 weeks. Hoarseness of voice after suppressed anger. Loss of voice after suppressed anger. There is no use expressing my views. Fine? You are angry and there is no point raising your voice. And then you go into hoarseness or aphonia. Don't forget staticide. Single remedy given in your repertory. I discussed, if you remember. I shared a case of, which case?
A lady who was going for an operation.
Very good.
And there she was.
So was this mentioned only to Dr. Shalaka? Then? So there was a case we discussed, and this case was of a lady who underwent cholecystectomy, and then there was some issues with insurance. Initially they told your insurance policy will cover everything. And once this surgery was done, what did they tell? Pay 1 lakh. Your insurance will not cover this. Some technical issues. And she had a lot of anger, and then she said, what is the point? So it was wrong. What happened? They told it will cover, and now in the end minute they are telling it will not cover. So she has a lot of anger, and what is the word we use here? Indignation. Righteous anger, indignation. And then she lost her voice. And after staff, she beautifully regains her voice. And staff is also a beautiful remedy for post-operative cases, post-surgical cases. Okay? So, stephysagria, that very important, must be, Shweta was raising this symptom when we spoke of selenium, a few minutes ago. And what was Shweta's point here was, there are things related to semen. Okay? No, I'll just read out and then I'll share a small case. Seminal emission, too early, too easy. Hope this part is clear. Okay? It is too early, too easy. Dribbling of semen during stool. This is what Shweta was talking about. Dribbling of semen during stool. I hope you understand. This is not normal. Okay? Dribbling of semen during sleep. See, dribbling of semen during sitting, walking, and repertoire use a beautiful word. And what is that word? Dribbling of semen or seminal emission unnoticed. Can somebody quickly interpret this? Seminal emission physiology and what is happening here? And then I'll give you a small case. What is the physiology? When should the semen? See, for example, seminal emissions during sleep. Is it normal or abnormal? Huh? Normal or abnormal? Simple question. When is it normal and when is it abnormal? So when he gets a lascivious dream, fine, and then he is ejaculating, it could be normal. So without any dream schemes and all, it is just going. See, even while sitting, okay, sitting you are not having any sexual thought. For example, in selenium, there is no sexual thought. For example, somebody has a sexual thought and then he ejaculates, okay. But see the situation, even while walking. I had a case, I have not given him selenium, but when I was reading selenium, I realized that case. Okay? So this gentleman, he had this very unusual problem. Sexually very weak, not able to perform with his wife, but this is something that just keeps, escaping semen. No erection. Please understand the situation. And I missed it, and he is a very regular patient. He will come back, and next I am thinking of giving him selenium. So he says, what is it, traffic signal here, there, no erection, nothing, and it just, my undergarments are wet. And then I go, I see, I would have passed, semen would have escaped. So this is the situation. Why I am stressing on this situation is very few remedies. 2 remedies during stool, semen emission, and going unnoticed or while sitting, while walking, which I just shared the case, is only selenium. He has vitiligo. That's why I did not think of selenium. I hope you are getting, must be selenium in this case might be a partially indicated remedy. Or we'll have to see if it can bring in some changes in the vitiligo. We are not sure. But tried a lot of remedies, have failed. So, when I was reading this, I thought, why not try selenium in this gentleman? Okay, so we'll see. Must be keep you posted about the improvement, whatever. So this is very, very important. Okay, and many of you were talking of impotency. Impotency in selenium. Okay, now what is it that you have in selenium? What is it that you have in selenium? Selenium has a lot of lascivious thoughts, but you will have impotency. You getting my point? Lot of fancies about sexual things, but unfortunately he is impotent. So this is the combination. lot of lascivious thoughts or fancies, sexual, but there is impotency. This is the combination I want you to remember. So typical image showing dissatisfaction, discontentment in the sexual life, and lascivious but impotent. That's what I was trying to highlight. Lascivious but impotent. Impotency with the desires. Lived thoughts but physically impotent. Okay? So you got many remedies. Mentally they have a desire, but physically they are not able to perform. What are the other remedies? Phosphoric acid, lycopodium. Okay? I also want you to add selenium. Okay? This is highly written in the source book. So just don't stick on only to lycopodium. Okay? For example, when lycopodium fails, or when lycopodium is not fitting into the case, and it is a case of selenium, never hesitate using selenium. Okay? See, now why many times we only prescribe lyco? Because we are not aware of other remedies. Let's be honest in accepting. So we have a routine thing and we just follow. So please try to understand why, what, and try to help the patient with the right remedy. And unfortunately, premature ejaculation, erectile dysfunction, what commonly we call it as ED, unfortunately it is increasing. Lot of work pressure, lot of stress, lot of targets, lot of things. They are all drained. If you go back to the selenium first photo, first image that I showed you, they are all drained. Right? So probably we don't know. If it fits into the patient's history, we can explore selenium in these patients. Okay? Erection slow, insufficient, too rapid emission. There is a rubric: emission too quick, ejaculation too quick. Many people coming for premature ejaculation. Semen dribbling during sleep. Okay? Semen dribbling during sleep. So these are few things you need to remember in selenium. And a valid point you people contributed a little while ago was constipation. There are many remedies in homeopathy. Okay, where we indicate very beautiful results. Okay. For today, we can either look at, we have another 5-6 minutes, we can either look at other remedies for constipation. Okay, and we'll also try to understand when selenium is indicated in a case of constipation. Remedies for constipation: platina, alumina, beautiful, Cilicia, ferrum, plumbum, lactifluoridum, cascara. Okay, fine, good. You should use the indication. Calcarea, good. Opium, tuja, good. Agreed. They're all there. So we'll start with Dr. Amrish. You was talking of a rare remedy. Constipation in old people. Cascara. Okay. Done. That's the only indication. Okay, no problem. See, he's given you a remedy, good is given it to you now. On this platform you can explore. Go back home and read Cascara. Okay, Cascara. So, mainly old people. No issues. You can go back and explore. It's a good assignment for you. Okay. Talk about calcarea. How is it in calcarea? Huh? How is it in calcarea? See, calcarea is a beautiful symptom. Better than constipated. Okay? So 3-4 days, calcarea patient is not passing stools, he will have absolutely no issues. He can eat, he can be what he is. The day he passes stools, then he will have some kind of a discomfort. That's a beautiful take-home message. Constipation, what is it? Better than constipated. Or constipation amelioration, calcarea. Okay? We are talking about opium. Dr. Antarja was talking of opium. When opium? When opium? Opium for obstinate constipation. Okay? Opium for obstinate constipation. Very stubborn, hard, obstinate stools, obstinate constipation. Okay. Celiacia, during menses, constipation during menses, good, agreed. Receding stools. One of the authors says shyness. Celiacia is known for shyness, no? So that author, I don't remember the name. Author says stools come and then it goes back. So it's only a comparison. Mentally they are shy, physically also they are shy, is what the author is trying to explain us. Receding stools comes and it goes back. Good, Celiacia. And it has to be removed mechanically. Yes. And somebody was talking of plumbo. How is it in plumbo? Mainly which comes from paralysis of the muscles of the intestines. Okay? And stools which are like sheep dung. Calicar, you also have chilidonium. You may have opium, like balls. You may have many more remedies. Plumbo. How is it in platina?
It sticks to the...
Okay, so adheres to the anus. Okay, let's use the right technical word. Adheres to the anus. The other remedy in brackets? Alumen. Alumen is also there for constipation. Obstinate constipation with headaches. Alumen. A-L-U-M-E-N. Alumen. Sulfur. I gave you a beautiful indication of sulfur from the repertory. And almost some 3-4 cases I have where I have used sulfur for the same situation. And what is the situation? Fear of passing stools. Because it remains of the previous 2 years past. And small kids, in clinics we have 2 years, 3 years, 1.5 years, they hold stool tight and they are not letting it go because it reminds them of the past experience. When passing stools, they would have had bad pain. So they are not going. I can't recall the rubric. Okay. There are 2 rubrics you will have to remember. Fear of passing stools, 1 rubric. Mind. Sulfur is the single remedy. And even in rectum, you have a rubric similar to this. And there they give you some 3 remedies. And sulfur is one of the remedy. So 3-4 cases, beautifully sulfur has done wonders. The happy mothers, they come back and they say, sir, now my child has no issue. He is passing stools on time. No pain. Thank you. Thanks to homeopathy. Fine, beautiful. Okay. Somebody, I don't know, आपने बोला था ना शायद lac defloratum. Beautiful remedy. Now what is it that you have in lac defloratum? I have shared cases, 3-4 cases to you in the previous classes. What is the one practical indication of lac defloratum? When the best, very good, when the best purgative fails. You're getting my point? And students who come to my clinic, you have seen this. In some cases, though we don't prescribe specific remedies in our clinic, but some cases we have such classical description given with the patients. That's how I'm taking some Ayurvedic preparation, some allopathic preparation, and in spite of all that, I'm not able to pass stools. And this is what Dr. Clark writes in his Materia Medica. Please go back home and read Clark's Materia Medica, lac defloratum. There he gives a sentence. When the best purgative fails, think of lac defloratum, not can, lac defloratum. Unfortunately, you don't have this in your repertory. At least the repertoire I use. I don't know if new repertories are included. So please remember lac defloratum. Constipation when away from home. Lycopodin. Constipation in travels. Platinum. Okay. So we'll see why there is constipation or what is the character of constipation in selenium. Okay. You had a point here. It has to be removed mechanically. This is what reminds us of Celiacia sanicula. Don't forget sanicula. Tuja. Allosocatrina. There are some 18 remedies mentioned in your repertory. Constipation stool has to be removed mechanically. And few authors, they say, so hard that it requires mechanical aid. First point. And if somebody is keen to know why there is constipation in selenium, It is due to atonia of the intestinal tract. And he says peristaltic movement is nil. So stools become impacted. It almost comes close to opium, plumbo, where there is zero peristaltic movement. How is it in Naxwamika? Nobody spoke of Naxwamika, constipation. Beautiful remedy. How is it in Naxwamika? I had a case, a patient comes from a far off place. Very beautiful case taken by the intern and we analyzed. But what came out very characteristic in this case was he has to pass to 20 to 25 times a day. Okay? Right? And what was very important for us was stools was very little. Okay? And through this class I am also trying to tell you is there are some peculiar particulars. Kindly catch hold of that. Luckily I got a rubric. Diarrhea, stools, frequent and all, scanty stools. See now what is this? The grandman, the old man is telling, sir, very little I am passing, but not hard stools, loose stools. So there is a rubric which says diarrhea scanty. This is what it means, diarrhea scanty. Little watery stools. And the remedy that comes up in the totality was Naxwamika. And Netra was shouting, ineffectual urging. So this gentleman also had that ineffectual urging. He gets the energy, goes. But what is the outcome? Is passing very little water stools. So we took stool scanty, something like that. And very hardworking guy, industrious guy, all that and Naxwamika. Now the frequency of stools has come down to 6 to 7. Fair. From 20, 6 to 7 after a dose of Nax is very good improvement. Okay? And it continues at 6 to 7. They have to come back for the follow-up. I will keep you updated. So I was just trying to tell you some 18 remedies mentioned in your repertory. Aloe, alumina, bryonia, calcarea, conium, lyco, meadow, natrum, mure, opium, silicia, sepia, sanicula. Having this situation, stools have to be removed mechanically. Okay? And then this thing did not come up in the discussion. Sleeplessness. Now what causes sleeplessness in selenium? Each remedy has its own reasons. I will not go into the description, but in selenium, pulsation. Okay? Pulsation. And pulsation in the abdominal vessels. Single remedy, selenium. Sleeplessness from pulsation in the abdominal vessels. Okay, when the abdominal vessels keeps pulsating and this pulsation is disturbing the sleep, the single remedy is selenium. Pulsation anywhere, all over, that is cactus. Single remedy, cactus. Sleeplessness from pulsation from any vessel, blood vessel is cactus. Sleeplessness from pulsation of the abdominal vessels is selenium. Okay? And one more very important thing is cat naps. What do you understand by cat naps? Cat lovers and people who have cats at home, they sleep for a very short period. Cat naps. And who is the patient who feels better by cat naps? He bounces back folic acid. 10 minutes, 15 minutes, and you will be surprised with this energy, which can go on for a long period. Folic acid. Okay? Now, the desires. They have desires mainly for alcohol. And something very interesting you have is, only remedy in your Materia Medica desires alcohol before menses. Single remedy. And I will not elaborate on this part with due respects, but before menses, urging for alcohol or craving for alcohol. In mind you have a rubric, alcoholism, menses before. Dipsomania, menses before. Single remedy, selenium. Okay? So desires alcohol, desires stimulants, refreshing things. Coffee, tea, mainly tea, lemonade. Okay? Mainly tea. So these are all the desires. And one strong aversion they have is salt. Aversion, salt. Okay? Now 2 minutes before we close, we'll just look at the mind symptoms. Nothing much. Lascivious with, what is the symptom I told? With impotency. Fancious sexual with impotency. Okay? And they have issues with concentration. Then they have issues with memory. And can somebody quickly recall the beautiful symptom of selenium? So what they forget in the day, that comes in the sleep. Sorry, that comes in the dreams. Yeah, sleep in the dreams. So for example, there is a business meeting. You would have missed something to share. And what he had missed to share, that will come up in his dreams. The only other remedy is caladium. Caladium. 2 remedies. Selenium, caladium. Sir, what I wanted to tell, I forget. When I have to tell, I forget. And the same thing comes in my dream. See, these are all very peculiar, highly peculiar symptoms, which you should remember. And don't laugh at these symptoms. Trust me. They will come back. Patient will come back in a similar fashion to your clinic and you'll be surprised. But you should be lucky. You should be blessed for them to come to you with these PQRs. Okay? Issues with concentration, confusion, memory, and memory is very, very important. And lascivious thoughts, sexual thoughts with impotence. This is in total about selenium. Okay? Any quick additions as a PG scholar? If at all you have used selenium anywhere in your practice, you are free to share, because my practical experience with selenium is minimal. Must be one reason, as I told you, I did not know much about selenium, and when I was reading selenium, I realized it can be used to one of my patients who has been seeking my advice without any results. That seminal emissions, without any reason, without any excitement. Not that he is physically getting excited, sexually getting excited, but there is just escape of semen. Okay? Any inputs from your end? Where you have used in your OPDs? No issues. Okay. So at least let's understand selenium properly so that we can apply it in our practice in a better way. Okay? So thank you. Thanks.